Simone, I mean, it seemed like it was only a matter of time before we moved to 4. How sweeping will this new campaign be?
Danny, right now it's very limited just to medical personnel, people over the age of 60, and also those at high risk for severe disease. But if the last booster rollout was any indication, then this is probably the start of a broader rollout for the population and potentially for the world. I know we've been talking about the booster dose for the past couple of months, but it now seems like we're going to start having to focus on the 4th dose. And part of this is some of the worrying data that we've seen from early studies. In Israel in specific, the Sheba Medical Center had a study of 40 of its staff, and it said that if for folks who had received their 2nd dose of the vaccine between 5 and 6 months ago, there was actually no protection against the Omicron variant, while those who had received a booster saw that protection come in and increase somewhat. Right now, Israel is, by the way, facing an uptick in infections, daily infections rising over 1,000, but thankfully the number of severe illnesses remaining low. Many of those infections, though, are Omicron. And Israel is, again, a really good proxy for what happens in the rest of the world because its vaccination rate, despite being early in the vaccine campaign, is still stuck at 64.5%, though 42% of the population is boosted because there's been hesitancy among various populations. At least for now, though, we're watching the pace of the increase in severe, or rather, hopefully not an increase in severe infections in Israel. And the government is shutting down travel from the United States, Germany, as well as Canada.